How we doing YouTube? Nick Pratap here from Next Gen Rehab, and in today's video I'm going to be going over blood pressure, specifically why blood pressure increases when we exercise, and why do we see a lower blood pressure post-exercise, right? So I've been getting this question quite a bit from clients. Nick, I exercise, my blood pressure goes up, and then after exercise my blood pressure is actually lower than when I first started. So let's break down blood pressure, all right? So whether it's been in the doctor's office, at home with your own cuff, in the pharmacy. Generally speaking, when we look at blood pressure, we have the two numbers, right? So you have a number on the top and you have a number on the bottom. So the top number is known as systolic, all right? The systolic pressure. So what that is basically the pressure within your arterial walls at which the heart pumps. So when your heart contracts, obviously it contracts with a certain amount of pressure. That pressure is detected on the arterial walls of your artery, in your artery lining. Okay, so that's the systolic pressure, the top number. The diastolic is what we call the bottom number. Okay, and so what the diastolic is the pressure on those same arteries when the heart is in a relaxed state. So it beats, you have pressure, that's the top number. When it relaxes, when it's filling with blood before its next contraction, that's what we call diastolic blood pressure, or the bottom number. And so that's why, generally speaking, the top number is higher usually, and then the bottom number is a little bit lower, or on the lower end, right? And so when it comes to blood pressure, I mean, generally speaking, you've probably seen the numbers 120 over 80 are kind of the general consensus. 110 over 70, we kind of start considering a little bit more optimal. If you're diabetic, we like keeping that blood pressure 130 over 80 or below. And then once you start getting, into the 135s, 1 to 140 range, your doctor might get you to start watching it a little bit more. Still okay, as long as we're keeping it below the 140, considering there's no other medical history. But once we start getting above the 140, right, 140 consistently, 150 consistently, then that starts to become a risk factor for potentially developing heart disease, all right? Especially if you're more prone, being a male, or if you have other risk factors, you smoke, you have higher cholesterol, or if you have predisposing family history. So if any of those factors come into play and your blood pressure is higher, your doctor will probably get you to try lifestyle changes first, change the diet, reduce things like sodium, sugar, and reduce your weight, start exercising more. If that doesn't help, then they'll probably put you on some medication. I've talked about some of the medications in my other videos, so you can check those out. But we do want to control blood pressure, especially if it's on the higher end, again, because it becomes a risk factor. So how about blood pressure when we exercise, right? So if you think about it, as we exercise, your heart is obviously needing to pump blood to your muscles, right? So it can't be pumping at a slower rate. So the speed at which your heart's pumping is going to increase. So that's why we see that increase in heart rate. When we're exercising, certain areas of the body start to get more blood, certain areas of the body get less blood, right? So more blood goes to the muscles that are working. So if you're doing like a run, obviously it's going to the legs and the arms. If you're swimming, it's a whole body thing, right? If you're doing weight training, it's going to those specific muscles that you're using. So these arteries are going to dilate, so we can get more blood flow into those areas. Other areas that we don't need to be using, like for example the stomach, right? Those arteries are going to constrict because you're not trying to digest food, and that's why we don't recommend eating within an hour of exercising, because if you are, and then you start to go for a run, you're going to start reducing blood flow to the stomach. You're going to increase blood flow to the other areas of the body, and you're not going to be able to digest that food. Indigestion happens. It's not a good situation, right? So we see the dilation of arteries to the working muscles, the constriction of arteries to the areas where you don't need blood for that moment. Heart rate's going up. As the heart rate's going to go up, your heart's going to have to contract more forcefully, right? More forcefully to get this blood to those working muscles. So that's why we start to see this increase in blood pressure, which is, again, a normal response, right? Once exercise is done, you sit down, you don't want to stay in this hyped up state, right? You don't want your heart to be contracting at a very rapid pace. You don't want it to be contracting too forcefully. And so we need to get into this phase where we get into the recovery mode, okay? And there's certain neurotransmitters released in the body, things like nitric oxides released to help relax the body. Your parasympathetic nervous system comes into play to bring everything back down to baseline. Okay, so after exercise, let's say you wait 10 minutes, these arteries are still dilated to a degree, right? So because these arteries are dilated, because we're bringing the heart rate back down, because the heart is not contracting as forcefully, when you go and take your pressure, again, this is not immediately after, but if you wait about 10 to 15 minutes, you've been breathing relaxed, then you'll find that your blood pressure is lower, right? And why? Because again, your arteries are dilated to those working muscles. So when arteries are bigger, there's more room for blood to move, hence the pressure is going to start to come down, right? So you'll notice that. The other reason it's coming down is because now your parasympathetic nervous system is kicking in to bring everything back down to baseline. So your breathing is going to be reduced, your heart rate's going to reduce, the pressure is going to obviously start to reduce as you return back down to baseline. Another reason why blood pressure might come down a bit as well is if you are sweating a lot, right? So you're sweating a lot, you're perspiring, your blood volume is going to tend to drop, right? So with the blood volume dropping, that's also going to have an impact on your blood pressure. So especially when we're working in the cardiac rehab setting, we ask patients that are particularly on blood pressure medications to stay hydrated throughout the class. This applies to anyone anyways, but and particularly because of the sensitivity to potentially getting more dizzy with these heart patients, or feeling lightheaded. Make sure you stay hydrated. If you notice lower than usual blood pressures, usually it's a matter of having some water. That pressure should come back up to whatever your normal is. Okay, so if you're on any fluid restrictions, obviously talk to your doctor about that. But generally speaking, yes, during exercise, blood pressure is going to come up, normal response, and then after exercise, blood pressure is going to come down. Again, normal response as we bring everything back down to baseline. Okay, so hopefully you found that video helpful. If you have any questions, go ahead and leave them in the comment section below. Once again, my name is Nick Pratap from Next Gen Rehabilitation. We'll see you in the next video.